have an order for a Q12-hour physical assessment for a 57-year-old female patient with influenza and C. diff. The patient is on droplet and contact precautions, and I will begin to apply my PPE after I do my 360 room scan. Patient is on the bed. And I will begin to apply my PPE. I'm going to begin by applying, and the PPE we'll be using will be gown, mask, and glove. I'm going to apply my PPE. I'm tying it at the neck area first. And the waist, the gown open to the back. And I'll apply my mask. And I'm going to apply my gloves. The sleeve of my gowns tucked in my gloves. Same on the right hand, the sleeve of my gown tucked down in my glove. Okay. I have checked the patient's chart. And I'm preparing to enter the patient's room. Let me correct. I hand hygiene before I apply my PPE. Okay. Getting ready to enter the patient's room. Knock, knock, knock. Enter the room. Close the door behind me for privacy. And here is my patient. Okay. Introduce myself. Good morning. My name is Sarah Horton. I'm from Austin Community College. Your doctor has ordered a physical assessment to be done, and I'm here to do that assessment. Is that all right with you? Yes, it is. Okay. Can you tell me your first and last name? Ann Lovebear. Okay. Thank you very much. Mrs. Lovebear, do you know where you're at? You're in the hospital. The clock on the wall, can you see the clock and tell me the time of day it is? Very good. Thank you very much. Mrs. Lovebear is oriented, alert and oriented ×3. Mrs. Lovebear, are you in any pain? No pain. Do you have any allergies? No allergies. Did you sleep well throughout the night? Did you get up for any reason throughout the night? You did? Okay. Did you need help getting out of bed? Didn't need any help? Did you use the restroom? You used the restroom. Okay, you had a urine. Did you notice the color of your urine? It was yellow. Was it clear? It was clear. Did you have any odor? No odor. Did you happen to have a bowel movement last night? No bowel movement? Well, when was your last bowel movement? 2 days ago? Okay, is that your normal regimen? 2 days, every 2 days. Okay, thank you very much for that information. Okay, did you have anything to drink throughout the night? Any problem swallowing? No problem swallowing. Have you had any recent falls, Ms. Lovebear? No falls? Okay, very good. Okay, so Mrs. Lovebear, we're going to begin to start your assessment, and I'm going to lower your bed rail, raise your bed up to a working position, and I'm going to elevate the head of your bed about 45 degrees for now, okay? Is that all right? Okay, everything's okay? Okay. All right, and I'm going to begin by inspecting your head from head to toe assessment is what we're doing. And if at any point while I'm doing this assessment, if you're uncomfortable, if you need me to stop for any reason, just let me know, okay? All right. So the head is within normal limits. The head is midline. No signs of abnormalities, no drooping, no breakdown noted, no skin breaks. The color is within normal limits for patient, appropriate for patient. Hygiene is appropriate for patient. Okay, Mrs. Lovett, I'm going to palpate your cranial, and I'm looking for any masses, any tenderness. Is that pain? Is there any pain as I touch your scalp? No pain, tenderness, any masses, thinning of hair, any baldness to scalp, any signs of infestation. Okay, I'm going to assess the occipital area. Any breakdown noted? No breakdown noted. Okay, I'm going to assess the temporal arteries. The pulses are equal in strength bilaterally, 2 plus. Okay, very good. And Mrs. Lovebear, can you open and close your mouth for me? Very good. The temporal mandibular joint is within normal limits. Mrs. Lovebear, do you wear hearing aids? No hearing aids, no problem hearing? Any pain in your ears or outside the ears? No pain? Okay, any problems with the ears at any time? No problems, okay. We're going to inspect the ears, the outer ear, behind the ear. No signs of breakdown noted. No tenderness. Is that painful to touch? No pain or tenderness, and then no drainage noted. Very good. Mrs. Lovebear, I'm going to occlude your left ear, and I'm going to speak into your right ear, and let me know if you hear. Dog cat. Dog cat. Okay, very good. Same thing with the right ear. Dog cat. Dog cat. Very good. The ears are symmetrical within normal limits. We're going to assess your eyes, inspect the eyes, the eyelids, the eyebrows are within normal limits. The sclera is white. No drooping noted. I'm going to assess the lower lids for the conjunctiva, and it is pink. The conjunctiva is pink. The eyes are symmetrical within normal limits. Do you wear eyeglasses, Mrs. Lovebear? Any contacts? No contacts or eyeglasses. Okay, I'm going to assess your pupils now. And just look straight and stare that way for me. See that light socket on the wall? Look straight at that light socket for me. Very good. Very good. Now, Mrs. Lovebear, I just want you to follow the pen with your eyes for me. Very good. The pupils are equal, round, reactive to light, and accommodating. Very good. Okay. Now I'm going to inspect your nose, Mrs. Lovebear. Any problem breathing through your nose? No problems. Any pain or discomfort? Any drainage noted? Okay. The nose is midline. The septum is within normal limits. I'm going to inspect the nares. It's pink, moist, no drainage noted. The nose is within normal limits. Mrs. Lovebear, I'm going to occlude your left nostril, and I want you to breathe in through your right nostril. Is the airflow good through the right nostril? Very good. Same with the right nostril, occluded, breathe in through the left. Any discomfort, any problems? Airflow is good? Very good. Okay, I'm going to inspect your mouth. The lips are within normal limits. The color is appropriate for the patient. No sores noted, no drooping noted, no abnormalities noted. Mrs. Lovebear, can you open your mouth for me and stick out your tongue? Take it a little bit to the left and the right side. Very good. Okay, can you open your mouth wide and say ah, ah? The uvula is midline and elevated as the patient says ah. The teeth are within normal limits. The mucosa is pink and moist. No sores noted. The gum lines are not swollen. No bleeding noted. The mouth is within normal limits. Mrs. Lambert, do you have any problem swallowing? No problem swallowing. Okay, very good. Okay, now we're going to inspect your neck area. Can you extend your neck for me? Very good. The trachea is midline. Can you turn your head left to right for me? Left to right. Very good. Now, Mrs. Lambert, I'm going to check your carotid pulses one at a time. Very good. And your right carotid artery. Very good. And can you tilt your head to the left for me? No evidence of JVD. Okay. Now, Mrs. Lambert, I'm going to assess your chest, inspect your chest, listen to your heart sounds and lung sounds, and I'm also going to inspect and auscultate your abdomen. All right. And we're going to start at your chest. The chest is within normal limits. No bare chest noted. No use of accessory muscles. The color is appropriate for patient. Skin turgor is within normal limits. Alrighty. Now we're going to listen to your heart sounds, Mrs. Lambert. And starting at the right side of the heart, we're going to listen to the aortic valve between the second intercostal space, noting the S2 sound, which is a dub sound, dub, and is heard loudest. The dub sound is heard loudest at this area. And to the left side of the heart, second intercostal space, we'll hear the pulmonic valve. And the third intercostal space, the Erb's point, where we would note any murmur if present. And the fifth intercostal space, the tricuspid valve. The fifth intercostal space, where we would hear the mitral valve, where we would take the apical pulse. And the S1 sound is heard here. The lub sound is heard louder at this area. Okay, very good. Now we're going to listen to your lung sounds, Mrs. Lambert. And I'm going to elevate your head just a little bit more to get you straight up, to get those lungs open. And we're starting over the tracheal, listening for the bronchial. Very good. Bronchiovesicular, left upper, right upper lobe. And bronchiovesicular, left middle lobe, left upper lobe, and vesicular, left lower lobe, and vesicular, right lower lobe. Okay, now we're going to listen to the lung sounds posteriorly, and starting at the lobe above the scapula on the right side. Deep breath for me, Mrs. Lambert. In and out. And the left side, same thing. In, deep breath, and out. And between the spine and the scapula at the T3 vertebra, we're going to listen to the lung sound. Deep breath in and out. And again, in and out. Now from T3 through T10, we're going to listen to the lung sounds throughout the posterior lung field. Deep breath in and out. Again, deep breath in and out. And the lower lungs at the bases, deep breath in and out. Deep breath in and out. Very good. Now I'm going to lower the head of your bed so that I can assess your abdomen. Okay. And we'll cover you there for privacy. Okay. I'm going to inspect the abdomen. There is no evidence of distension noted. No discoloration around the umbilicus. No masses noted. Okay, the umbilical is midline. Now I'm going to auscultate the breath sounds. Starting at the right lower quadrant, I'm going to listen for 5 to 15 seconds. And the upper right quadrant, listen for 5 to 15 seconds. The upper left quadrant, I'm going to listen for 5 to 15 seconds. And the lower left quadrant, I'm going to listen for 5 to 15 seconds. And now, Mrs. LaBear, I'm going to palpate your abdomen. And if you should feel any pain or tenderness, please let me know. Okay, I'm going to palpate the lower right quadrant. Any pain or tenderness? No. The upper right quadrant, any pain or tenderness? No. The upper left quadrant, any pain or tenderness? No. The lower left quadrant, any pain or tenderness? No pain or tenderness. Any problems when you go to the restroom for a bowel movement? Any problems starting urine? Okay, no problems. All right. Any problems with your diet, your food, eating, swallowing? No problems. Very good. Okay, now I'm going to assess your upper extremities. We're going to listen for the brachial pulses. The brachial pulses are equal bilaterally 2+, and the radial pulses are equal bilaterally 2+. Mrs. Lovebell, can you squeeze my 2 fingers? Very good. Okay, can you try to pull me toward you and push me away? Very good. The capillary refill is less than 3 seconds. Capillary refill less than 3 seconds. Skin turgor is within normal limits. Skin turgor within normal limits. Now, Mrs. Lovebell, I'm going to ask you if you could roll over to your right side for me so that I can assess your posterior torso. Okay. The spine is midline. The coccyx area, it was without evidence of breakdown. No redness, no discoloration. Any tenderness or pain to touch, Miss Lovebell? No pain to touch. The peri area is within normal limits. No breakdown noted. Skin is warm, dry, and intact. No pain, no evidence of breakdown or the bony permanences at the scapular area or the occipital area. Okay. Okay, Mrs. Lovebell, same thing with the right side. Can you roll to the right side? Very good. Okay, no evidence of skin breakdown. Any pain or tenderness to touch? No pain or tenderness. Peri area. Skin is warm, dry, and intact. The spine is midline. No evidence of breakdown. No redness. No mass. No tenderness noted. Very good. Okay. Now I'm going to assess your femoral pulses. And the pulses are equal in strength bilaterally 2+. I'm going to assess the calves. Any evidence of DVT? None noted. No edema to the shins. No edema noted. No evidence of DVT bilaterally. Remove the patient's socks. I'm going to check the posterior tibial pulses. And the pulses are equal in strength bilaterally 2+. The dorsus pillar pulses equal in strength bilaterally 2+. Capillary refill less than 3 seconds. Cap refill less than 3 seconds. No evidence of skin breakdown to the heel. Skin is warm, dry, and intact. No evidence of breakdown between the toes, around the toes. Okay, very good. Now, Mrs. Lovebear also have a 18 gauge IV to the left forearm with IV fluids and antibiotic infusing. No evidence of infiltration, no redness. Is there any pain at your IV site, Mrs. Lovebear? No pain or discomfort. Very good, thank you. And this patient's vital signs for 120, for the blood pressure 120/80, the pulse was 74, respirations 18, temperature 98.6, O2 saturations 98. This patient is in stable condition. Mrs. Lovebear, this ends your assessment. Can I get you anything before I leave? Anything to drink? Do you need to use the restroom? No, you're fine? Okay. Okay, I have your possessions, your table. I brought it to your bedside so that it'll be within your reach. And your call light is in place if you need the nurse, okay? All right, Mrs. Lovebear, I will be back to check on you in 1 hour. Okay, this ends my assessment. I am going to prepare to remove my PPE. I'm going to, first of all, remove one glove into the hand of the other with my thumb. I'm going to remove the other glove, fold it inside over the other, put it in the trash. Hand hygiene. I'm going to remove my gown and tie it from the back, allow it to show up from my shoulders, from the inside out. Inside out, I'll bring it. This goes the gown. Hand hygiene. Prepare to exit the room. I have my supplies. Exiting the room. Remove my mask, exit the room.